Okay, Dr. Shannon Clark here. I am a double board certified OBGYN and maternal fetal medicine specialist, and I just got this comment on one of my posts. My practice just did it as a routine prenatal test. I got a toxoplasma IgM positive and a toxoplasmosis IgG negative. So she's wondering what that means. So let's talk about toxoplasmosis and pregnancy. So toxoplasmosis is caused by an intracellular parasite called Toxoplasma gondii. So Toxoplasma gondii exists in multiple forms. It's going to be a trophozoite, a cyst, or an oocyst. And human infection occurs when someone ingests the cyst in either undercooked meat from infected animals, consumption of insect-contaminated food, contact with oocyst from the feces of infected cats, meaning the cat got infected and then when they went to the bathroom, those cysts are in their feces, or contact with infected materials or insects in soil. So that's why we talk about pregnant individuals making sure that they wear gloves when they're gardening. If a pregnant individual gets acutely or initially infected with toxoplasmosis in pregnancy, the risk of a congenital infection of the fetus and neonate is about 20 to 50% if it's not treated. The later in pregnancy this primary infection occurs, the greater the chance is that the fetus will be infected. But the earlier in pregnancy the fetus is infected, the more severe the disease will be in the fetus, as opposed to infection later in pregnancy, the less severe the disease will be in the fetus. Now, ACOG does not recommend routine screening, like on those initial prenatal labs, for toxoplasmosis, IgG, and IgM, like was done in this person. And that's because, as ACOG says, serologic assays for toxoplasmosis are not well standardized and have high rates of false positive and false negative results. Also, a positive IgM may persist for months to even years after that initial infection. So even if a pregnant person is IgM positive, it doesn't mean they got infected in pregnancy. If the IgM is negative and the IgG is positive, that means that there is some kind of infection in the past and there's no concern for infection during the pregnancy in the fetus. If IgM and IgG are both positive, that means the patient has either had a recent infection or it's false positive. Negative IgM and IgG means there is no infection or there's a recent acute infection, but the IgM hasn't had time to become positive yet. So ACOG recommends that screening for toxoplasmosis in pregnancy should only be done for those patients who are immunosuppressed or they are HIV positive. So we only do testing for toxoplasmosis if we suspect infection based on the clinical symptoms and signs in a pregnant individual or we see something on ultrasound. So in this case, the IgM is positive and the IgG is negative. So that could mean that there was a recent infection, in which case the titers need to be repeated in 2 to 3 weeks to see if that IgG starts to increase in response to a recent infection, which caused the IgM to be positive. In addition, if the IgM is positive, then the diagnosis needs to be confirmed by an experienced reference laboratory within the United States. And if your provider goes to UpToDate and looks up toxoplasmosis in pregnancy, they will give the name of the lab and the phone number. So overall, it's important that whoever is ordering these labs, especially if they're doing a screening for toxoplasmosis, that they know how to interpret the results of those labs and what to do if there is concern for acute infection in pregnancy. If they don't know, they need to get infectious disease on board so they can work it out. But in reality, routine screening should not be done in someone who's asymptomatic and has no clinical signs and symptoms of toxoplasmosis because the testing that we have is not ideal, or the methods that we have for testing is not ideal.